Can you see the document, Farah? Farah?
Oh, can you hear me? Oh, you can't hear me?
No, I didn't hear. Yeah, can you see this?
Yes,
The
yes, yes,
document?
I can.
Okay. Okay.
Is my does my voice sound okay?
Yes, yes.
Oh,
Earlier I didn't hear your reply. Maybe at that time you were muted. Now I
oh,
can hear.
all right.
Okay, so we did convulsions. We had to start with GIT, I think. Yeah.
Stop
So
for
the
sleep. Yeah.
yeah, we stop with sleep, and now we'll continue with GIT. And
Okay.
GIT actually, yeah, everything is of importance. The GIT total, mostly it is Nux vomica, Lycopodium pulsatilla, that is
Mm-hmm.
more important. But still starting with Nux vomica GIT. So we know their main problem is from sedentary lifestyle. So we'll be having indigestion problem and also the complaints of hemorrhoids, bad effects of coffee, tobacco, alcoholic stimulants, and highly spiced or seasoned food, the overeating as such. There will be nausea, vomiting, and the patient feels if only he could vomit, he would be so much better. And there is a pressure that is felt an hour or two after eating. There will be a discomfort. He will be feeling amelioration only when the stomach is empty. So the fullness, there is a sensation of pyrosis or a full sensation, and then he should loosen his clothing. Cannot use the mind for 2 or 3 hours after a meal. This symptom is actually very important, and we can find these people in the
Oh,
office also. They are
okay.
generally very workaholic. We see that they stay up at night to even do their work, everything.
Uh-huh.
Still, after a meal, they because maybe they eat full or overeating, or the food that they like, it produces indigestion. They feel sleepy or they can't use their mind for 2 to 3 hours after a meal. Sleepy after dinner, from anxiety, worry, brandy, coffee, night watching, etc. Then there will be constipation. We have seen its nature also. They will be frequently feeling that desire, and that is due to that excessive peristalsis. And constipation, why we say that? It is not because there is no complete movement of stool, but it is because there is an unfinished sensation. They want to go to stool, pass stool again and again. Then this is important where the desire is felt. Desire is usually felt in the upper abdomen. This is an important point, and the same sensation that we can see in ignatia also. 1 minute. I need to from that. Yeah, actually, this is usually asked for maybe MCQ. Uh, Here, in case of constipation, where the desire is felt, in case of Naxomica, the desire is felt in rectum, and in Ignatia and Veratrum album, the desire is felt in even when the upper abdomen or epigastrium. And what that means is, what indicates is, it's not the location as such, but it is that sensation when they feel. In case of Nuxworm, they feel that sensation to pass stool. Generally, usually, it will be when the stool will be accumulating in that rectosigmoid area, and then it goes towards the anal region.
Mm-hmm.
So here in case of Nuxworm, as usual, they will be feeling when the stool reaches in the rectal region itself. But in case of Ignatia and Veratrum, in case of Knoxworm, it's more or less okay. Something also similar. It is not in the anal region exactly, but just before to that, maybe that due to the excessive peristaltic movement. So even when they pass, go to pass the stool, because the stool hasn't yet reached the anal region, or the desire was felt when even it was in the rectal region,
Okay.
they have like a they have to wait for some time or something like that. But in case
Ah,
of Ignatia and Veratrum, what happens is they have that desire even when the stool. It is not that the stool is formed in the epigastrium, but they feel when the stomach is full. Even then they feel like they have to pass the stool. So, very hours before the stool is digested or the stool is formed, sorry, the food is digested or stool is formed, even hours before that, they have a sensation, that fullness from that full sensation or the filling of abdomen or the epigastrium region itself, the upper abdomen or the epigastrium, you know where that position is,
mm-hmm.
about to the umbilicus. So even if the fullness is felt, like the food has just reached the stomach, then itself they have a desire to pass the stool. In case of Ignatia and Veratrum, and both of these medicines, they have got hemorrhoids also.
Okay.
So this one, when we say the constipation, it is showing that nature of hemorrhoids, because of the hemorrhoids, the pressure also, they will be having a tendency or a pressure sensation to pass the stool. So in case of Nuxworm, it will be towards the end area, that's in the rectum. But Ignatia and Veritrum, even if you forget Veritrum, it doesn't matter. But in case of Ignatia, it will be felt in the upper abdomen. And why we need to learn this is in case of differentiation, because both belong to the same family, the Strichinos. So when we are making the comparison, it can more easily come for comparison Axform and Ignatia. So when we make the comparison, this is a differentiating point between them. In case of Nuxform, the desire to pass stool is felt only when the stool reaches in the rectal region.
Uh-huh.
But in case of Ignatia, because of that full sensation or something, and they also have the symptom like they have a empty organ sensation, which is not ameliorated even by eating, because Ignatia is a medicine of contradiction. So they have a full empty sensation, which is not ameliorated by eating, and then somehow we can see that fullness or the desire to pass stool, even when the epigastrium is loaded.
Okay.
So that is a contradictory feature of Ignatia also, that desire to pass stool even when only the stomach is full and not even the digestion has properly taken place. But over here, that desire, that location, because just because they belong to the same family and there is some comparison between them, that location at this point become important. So in case of Naxwamikia, they pass small quantities of feces as if the sensation it is not finished. Then alternate constipation and diarrhea, especially in people who have taken purgatives all their lives. In case of Ignatia, their main symptoms will be due to the emotional suppression, grief, etc., affecting the GIT. So, and starting from the throat, they will be having that globus hystericus, a sensation of lump and as if it is going down. So, the swallowing gives them a slight amelioration, but then it is coming back. And it is nothing like there is something permanent over there or some anatomical changes have taken place. It's completely hysterical related or nervous in origin. They're just feeling like that. And this sensation is also important in them when they are sorry, when they are biting or swallowing, they will be biting inside their cheeks. It's also a characteristic feature of them. And sweat on single face, spots only while eating. That's yet another important feature of this. Then constipation, they have from carriage riding or paralytic origin with excessive urging felt, which is more in upper abdomen or epigastrium. There will be great pain, and they dread to go to the closet, and in women who are habitual coffee drinkers. There will be prolapse ani from moderate straining at stool. Prolapse ani even when the stool is loose. Usually, we don't expect hemorrhoids to happen when the stool is loose.
Yeah.
Usually, it happens, yeah, when we are straining. That means
Okay.
there should be constipation. The people are having constipation, yes, but still the prolapse of ani that can be seen when the even when the stool is loose, and that is because of their contradictory nature also. Hemorrhoids prolapse with every stool have to be replaced. So have to be replaced means it is not yet fourth stage or the procedentia, that has not happened. So prior to that, there will be sharp stitching pain shooting up the rectum, and that will be for hours after stool passing. So usually that pain should have been ameliorated after they pass stool. Usually that pain, it will be felt during the passage of stool, and after passage of stool they should have an amelioration. But here in case of hemorrhoid ignatia, because it's a medicine of contradiction, they will be feeling that pain even hours after passing stool. And this is important because we have another remedy over here for comparison, and perhaps you have not studied it, nitric acid. Have you studied?
No.
You have studied?
No. No. No.
Yeah. So in nitric acid also they have like this, the sharp stitching pain shooting up to the rectum for hours after
I see.
stool. Even sulfur has that. So anyway, in case of ignatia, it is mainly due to their contradictory symptom. And nitric acid and sulfur, they don't have contradictory symptoms, but for them they also have this stitching pain shooting up to the rectum, like from the anal region it will be moving inside, I mean ascending up towards the rectal region, and that will be the hours even after passing through. Then in case of chamomilla, we've seen that it will be mainly affecting the abdominal nerves, causing its irritation, abdominal pain and cramping, which is relieved by bending double. There will be colicky pain, which will be ameliorated by eructations, and also coffee. Coffee also ameliorates that colicky pain. There will be diarrhea and that nature, especially seen during dentition, and that is the stool green, yellowish, like chopped egg or spinach,
Mm-hmm.
very hot and offensive. Patient is thirsty always. And whenever we make a comparison with chamomilla and pulsatilla, you have to remember this thing. If the question, because both are contraindication in the sense with their mental feature. In case of chamomilla, we saw that if there is a mental calmness, chamomilla is contraindicated, and pulsatilla is contraindicated whenever there is a tantrum. So both of their mental features are very important. So when we, if the question is to compare the GIT of chamomilla and pulsatilla, the this one, the patient is thirsty always. In case of chamomilla, that becomes important
Okay.
because in case of
Pulsatile.
pulsatilla, it is thirstless actually.
Okay.
So in case of pulsatilla, they go for the general symptoms like GIT mainly due to the hormonal changes, the emotional sensitivity or desire for sympathy. Like mainly with their constitution, and the problems arise due to eating fatty or rich food. There will be nausea with preference to open air or fresh air, all-gone sensation, especially in tea drinkers. Diarrhea will be there, but it is only during night. This is an important feature of pulsatilla, diarrhea only at night. And the nature of the stool, it will be very changeable. We have seen that in one of their common symptoms that no two symptoms will be alike,
Mm-hmm.
no
Mm-hmm.
two stools will be alike. So changeability is a very characteristic feature. As soon as they eat from fruits, cold food, drinks, ice cream, etc., and thirstlessness with nearly all complaints. And when you're doing the, in case chamomilla and pulsatilla, don't forget their mental disposition also.
Okay.
Your chamomilla, well, it is very irritating
Noted.
one, and pulsatilla will be very calm, peaceful. But they will be sad also, lachrymose also, changeable disposition. Now we go to lycopodium. They have craving for sweets and aversion to onions or garlic. This craving for sweets is important for them, and everything that tastes sour, every irritation, so heartburn, water brush, whatever, that will be tasting sour. There will be canine hunger. The more he eats, the more he craves. Head aches if he does not eat. But more than that, it is a trio of flatulence. So there will be excessive accumulation of flatulence, and when they pass flatulence, he will be getting amelioration. There will be accumulation of the gas, especially in the lower abdomen. Here we have a symptom like there is a canine hunger. The more he eats, the more he craves. That is one extreme feature we can say. But generally, they have what they have is constant sensation of satiety.
Mm.
Even few mouthfuls fill up to the throat, and he feels bloated. Though we see both the symptoms, now I don't remember from where did I take that sentence. Though we see both the symptoms, I would say that more than this word, the more he eats, the more he craves. I would want you to remember this sentence. I will just tell you this sentence from your level. This will enough. Because even if you forget the other one, it doesn't matter. This is the most commonly seen symptom. They will be having a sensation of satiety. Then this I already told you, the fermentation, the flatulence being accumulated in the lower abdomen. And this one that we made the comparison, upper abdomen carbohydrates, the entire will be synchronous.
Mm.
Constipation will be there since puberty, last confinement, when away from home of infants with ineffectual urging, rectum contracts and protrudes during stool, resulting in piles. So we can see piles in three conditions or three medicines rather, in case of nuxworm, ignatia, and lycopodium. So you need to differentiate that. What is last confinement?
Last time they gave birth.
Yeah,
Yeah.
their last delivery or last pregnancy. So that is about the GIT. Files also that you don't forget. I'll just put this in. Then female reproductive system. In case of Nuxformica, we know the personality, and the menses will be too early, too profuse, too long lasting. Menses is important in case of Nuxformica and also Pulsatilla, yeah,
Uh-huh.
of these remedies actually. So in Pulsatilla, it's late actually. The menses is actually late and less, but here in case of Nuxworm, it's the opposite: too early, too profuse, lasts too long, and it keep on several days. That's not the thing. Can appear every 2 weeks, never at right time, stopping and starting again. During and after, there will be aggravation of old symptoms, and they can have backache. if you are going to take this backache in keynote, actually you will see that the backache is usually seen with sexual weakness or masturbation due to excess of masturbation. But because backache can be connected with dysmenorrhea, uh, this backache is a feature in nux vomica when we say about their menstrual feature also. Because this particular feature in backache is very important. The person has to sit up to turn over in bed. That's the kind
Mm.
of backache they have. So even if the causation is due to masturbation or sexual weakness associated, just because of that particular moment they have to take, just to turn on the bed, they have to get up and then uh, turn. Otherwise, just lying down and they can't turn like that. It may be due to their body ache, but the body soreness, anything.
Mm-hmm.
But or they can be a symptom of this one. What is that? Chronic fatigue syndrome.
Mm-hmm.
They have that malaise, so we can connect it to that. But anyway, this feature is very important that they can't directly turn in the bed. They have to sit up and then turn. So because backache is a feature of dysmenorrhea also, we need to mention that. Then excessive bleeding, we told that. Premenstrual syndrome, there will be mood swings, irritability, and breast tenderness. Desire for stimulants. The labor pains. Yeah, labor pains is also important in case of nux vomica. There will be violent spasmodic pain, which causes or urging to stool or urinate. And the pain is more felt in back. And because the person is very chilly, he prefers a warm room. And this is important actually. In case of Ignatia, they also have this menses which is too early, too profuse, black, clotted, and putrid offensive order, similar to that of Nux vomica. And then they also have labor-like pain followed by purulent corrosive leukorrhea. Emotional symptoms during menstruation, sensitive breast and nipples. As such, Ignatius, what is that, female reproductive system is not that important, but I just kept it because if we get a Ignatia constitution person
Yep.
and like we got all those symptoms and then go towards just to confirm that they have this menstrual character, we can go because even though this symptom, the early profuse black clotted one, we can find in other drugs. In this case, in Nux vomica also, the mental feature, the personality of both the drugs are two different things. So it's not necessary that, I mean, Ignatia, female reproductive system, to be asked for an exam is
Uh-huh.
very, very, very rare. We won't
Okay.
be asking. But in your practice, you can meet any type of people. So
Yeah.
if you meet a yeah, ignatia patient or someone who is with an ignatia constitution and they have their menstrual complaints, you can think about the medicine. But usually the menses will be like this: too early, too profuse, black clotted with offensive smell. Hmm. All the other symptoms are not that important. That's why I didn't make any color also.
Mm-hmm.
Then chamomilla, that we saw that extreme sensitivity, irritability, their labor pains is very severe. We saw that yesterday. They will be saying like, I can't, and they just want to get away from that. Um, then there will be the mastitis. The nipples is inflamed. Uh, the milk will be running out from nursing women and then labor pains, it will be in the center of the abdomen and then
Mm-hmm.
radiating to back and also towards the thigh region. So that is what make the chamomilla more important. In case of chamomilla menses, the flow is not much important, but in case the person is having dysmenorrhea and throwing tantrums, as like we say in chamomilla during menses, because they are not ready to suffer even the least pain. It is unbearable for them. They just want to get away. So then you get that colicky pain or the dysmenorrhea. We can think about chamomilla. But chamomilla, rather than the menses or its flow, it is more important with that pain. So remember the labor pains and the nature of the mastitis, the milk running out. And when you're doing this comparison, I know you know to do that, but still, uh, not every drug will be having all the symptoms of that particular part. Like for this one, chamomile itself, reproductive system, it's not necessary that they should have starting from menses. The menses should be like this. For
Mhm.
leukorrhea should be like this, or the labor pain, the mastitis. There is no necessary that all the symptoms should be there. We just need to find out what is the characteristic feature and then differentiate. And if we don't get like Nux vomica and Chamomilla, female reproductive system. In Nux vomica, we'll be saying about the menses character, the backache, and menses character, yeah, the early backache, that is the most important in them. But when we come towards the chamomilla, even in female reproductive system, we don't have a particular bleeding nature or that menses will be early, late. Nothing we have over there. But for them, it is usually the mastitis, the labor pains that is highly characteristic. And in labor pains also we can differentiate because here the people want to get away from them. And in nux vomica we have seen that the labor pain, the patient, it's not like that he wants to get away with the pain, but he prefers a warm room because he's having that chilly sensation always,
Mhm. Mhm.
and that pain is causing him to stool or urinate. So when we come over here, it is that labor pains which is we can differentiate. It is not nothing related with menses. So over here, the person is actually having pain, which is aggravated from heat, which means that they may be okay if it is slightly cool over there, or a slightly cold room. If it is AC or something, maybe the chamomilla patient may not feel that much in distress, but Nuxmom patient will be like want to get away from this AC aircon room or something. They want
Mhm.
to that warm room actually. So
Ah.
when the questions are asked, and even if this labor pain was not there, now in case of Nuxmom and chamomilla, we have that labor pains to be compared. Even if it is not there, there should be some similarity or some difference, and then we have to differentiate between the constitution. That's how we do the differentiation with the drugs. So it's not necessary that all the symptoms of that particular organ or that particular structure should be present in both the medicines, and it should be opposite to each other. That is also not necessary. It can be similar, and when it is similar, we compare and contrast with their general features. In case of pulsatilla, the women who are fleshy, scanty, and protracted menstruation, so exactly opposite that of the nux vomica.
Okay.
The first serious impairment is starting with the puberty age. They say that they have been never well since then. Pain will be they have a characteristic feature which will be rapidly shifting. Okay, I have not covered this actually. Then there will be a constant chilliness. Even chilliness is a feature of nux vomica also. But in case of nux vomica, they are feeling chilly and they prefer warmth. And in case of pulsatilla, they are feeling chilly, still they prefer cold itself. Okay. The more severe the pain, the more severe the chill will be. It will appear suddenly, leave gradually, or it will increase to an acute and then suddenly decrease. That's the nature of the pain. There will be derangement, any complaint of menses. Usually it will be delayed, but it can be irregular, suppressed from getting feet wet. Did I explain you like this was some connection with autonomic nervous system actually?
No, you didn't.
Yeah, so this I just referred. I mean, I didn't refer. I asked to my friend,
Mhm.
and she told that it is more or less related to the autonomic nervous system, because pulsatilla is having an action on the nervous system, and the autonomic nervous system also has a connection physiologically to the HPO axis, hypothalamus pituitary
Uh-huh.
ovarian axis. So some dynamicity happening over there. That is the reason, because that much cold is enough, because pulsatilla is that sensitive remedy. Uh, Even this slight cold is enough to bring about an alteration in their HPO axis, thereby affecting the menses. So it shows
Mm.
that delicate and sensitive nature of pulsatile actually.
Okay.
So the menses can be suppressed from getting the feet wet. Too late can be painful, irregular. With chilliness, that's more, and the flow is more during daytime. Now, this comparison we will be dealing with later. The whole sentence is actually very important. Okay. Then there can be threatened abortion. Even in chamomile, we have seen threatened abortion. I think I didn't mention threatened abortion out
Mm-hmm.
of anger. But
Yeah.
here also
You did mention. You said.
we mentioned, okay.
Yeah.
So threatened abortion, the flow ceases and then return with increased force. They don't say the reason why, it is just the physical causes. They have this fainting, must have fresh air. But I would say threatened abortion, if we are giving for pulsatilla, the thing should be matching with their constitution. That lacrimose, because there are other better remedies for us in case of abortion. Sepia is the, Helonius is the,
Mm-hmm.
mm, then colophyllum.
Oh.
Yeah, we have some other remedies, some good other remedies. So, in case of pulsatilla, threatened abortion, rarely prescribed, but we need to be very sure with their constitution. Then, and it is actually told that none of our medicines should be given if the lady is pregnant for the first 3 months, including belladonna. Because sometimes, if the person is extremely sensitive, though we say our medicine is not that problematic, sometimes
Yeah.
it can be problematic. It can cause abortion. We should be very careful when we are giving medicine, our medicine, initial months during pregnancy.
Okay.
So they have changeable menstruation and delayed first menstruation, emotional symptoms, etc. In case of lycopodium, the most important feature will be this dryness of vagina, and dryness of vagina that can lead into uh, infertility, burning in during and after coition. So that can prevent coition because of this extreme dryness, and that can result in infertility. There will be physometra also. It is also another important feature. You know what is physometra, right?
Mm-mm. No.
Physometra means, I don't know how it happens, but uh, flatulence, not exact flatulence, but air moving out from the vaginal region.
Oh. Okay.
It's a technical term is, or medical term is
Isometra.
physometra.
Okay.
Then there will be discharge of blood from genitals during every stool. And this is a feature. Fetus appears to be turning somersault.
Oh, okay.
I don't know whether I have anyone given medicine for that. However, we have that symptom.
Wow.
And then infertility in females. And infertility in females, we can connect it, as I already told, the dryness of vagina.
Mm-hmm.
When we come towards the reproductive system of lycopodium, here we have to mention about the impotence also. Even in Nux vomica, there can be impotence, but then that importance will be more related to their lifestyle because of their workaholic nature, their desire for all those things, the stimulants, which is causing uh, that nature of like a sterility in them. But in case of lycopodium, though they also have that sterility or impotence, the problem is something else. It is usually due to sexual excess, onanism, the organ itself. The penis is small, cold, relaxed. There is strong desire but imperfect erections. The person falls asleep during embrace, and there is premature emissions. So here we need to compare it with that of the Naxmom with the because the causations, the etiology, everything is different. And why I kept over here, though it is a female reproductive system, uh, I mean, it will be very safe. When after you mention all these things, the
Mhm.
dryness of vagina leading to infertility in females, then physometra, and all these things, the fetus appears to be turning somersaults. A last sentence where you mention like, oh, it's a good remedy in case of males also, even if the question is female reproductive system, after
Uh-huh.
mentioning all this, just to mention that it is also good in case of male impotence,
Okay.
where the penis will be small. Just one or two features. Penis will be small. This one is important. He falls asleep during embrace. Even that process is enough.
Oh,
So yeah, then how the baby is going to.
falls asleep during embrace, as in
Yeah.
during hugging.
Yes.
Okay.
There is no chance. Then we don't have to speak about anything else. But they fall asleep during embrace. Maybe they are physically that tired. Some other organic diseases are there, or they can be due to the premature emissions also. Because during the process of embrace itself, the emission happens.
Okay.
In diseases like uh, BPH,
Uh-huh.
prostatomegaly, then prostatic cancer, but there is a prostatomegaly, and then another one, diabetes. They may have this premature emission. So it is not during the process of just hugging, but in that foreplay itself, during that foreplay itself, if they
Uh,
have that emission, then they are losing their desire. Once the emission is done, they lose their desire, and then they will go sleep. So maybe that it can be that the person is falling asleep, or it can be also that the penis is cold and relaxed. It is falling asleep, or it is not getting erection.
okay.
Or it can be also due to the premature emission has happened, and then the penis became cold and relaxed, so that the proper intercourse is not happening. These are the reasons, possibilities why because of which Lyco can have impotence. So even if the question is about female reproductive system, and it is very rare because Lycopodium reproductive system means it is male's reproductive system, or the impotence that is more important. So they will be generally asking Lycopodium in reproductive system, so that both comes together.
Okay.
I mentioned. Usually the question will be like that, but in case if it is only FRS that being asked, still put a last sentence. Though having mentioned FRS, the male reproductive system is also important, but there can be importance due to just in one sentence. One sentence is enough. Then only that lycopodium drug will be complete.
Okay.
Then the last one is fever. Most of these remedies are good for intermittent fevers. And if at all one remedy is not, if that important is just lycopodium, but lycopodium is also we can give in case of hepatitis where there is liver or gallbladder that is affected, the jaundice related. Anyway, in case of fever, other remedies are more important. So we'll start with, and fever, it is not the acute viral fever we say about, it is the intermittent type of fevers we see. So in case of Nux vomica, the fever will be the with great heat, whole body which is burning hot, the face red and hot, yet patient cannot move or uncover without being chilly. So when the person is actually feeling this much red hot nature, we feel that the person will be preferring to uncover his body, but not Nux vomica. Nux vomica is always very, very, very chilly, and they cannot bear to be uncovered without being that chilly. They must be covered in every stage of fever, in chill, heat, or sweat, whatever be the stage. They have extreme repugnance to the cold or cold air, chilly. So that is the most important feature. Whatever be the stage, however hot they are feeling, however they are sweaty, it doesn't
Uh-huh.
matter. They want to be always covered. They
Okay.
can't bear to be uncovered. Then fever can be associated with digestive disturbances, nausea, indigestion, etc. Then maybe you can just mention about its constitutional guiding features. In case of ignatia, we have the intermittent fever. where there is marked periodicity. Because in Indonesia, we have seen that the complaints return at the same hour every day. So that feature make it suitable for intermittent fever. In the chill stage, the patient is having a red face, and that chill stage, we don't expect the patient to have thirst during chill stage, but ignatia, they will be having thirst. And the chill stage is ameliorated by external heat, nothing over there. In the heat stage, we can see the contradiction. We expect the red phase to happen during the heat stage, but during the heat stage, the patient is having pale face.
Oh,
And in heat stage, we expect, because it is heat, the person is getting heated, we expect the person to have thirst.
red.
But in case of ignatia, they don't have thirst at that time. As soon as the heat commences, he must be uncovered, opposite to Nuxform. They are getting aggravated because when the heat stage is when it is coming to heat or that covering, it is going normal only. But in case of their face color and their thirst, it is contradictory nature that it is showing. And in the sweat stage, also there is no thirst. We expect thirst during sweat stage, but even that stage there is no thirst. So in case of ignatia, the thirst is characteristic. It is present only during chill stage when the person is having a red face, but not in the heat stage or sweat stage. There is no thirst. And there is a sensation as if the sweat will break in, but that doesn't happen. The usually sweats happen when the person is sweating. When he is sitting, especially on the face. Then this I have mentioned earlier. Fever triggered by emotional stress or grief, palpitations and sighing during fever. Can forget palpitations but remember
Sigh.
the word sighing. Headache, as if a nail is driven through the side. It's like a concomitant through the side and relieved by lying on that side. So the main feature will be in case if ignatia intermittent fever, it shows that the symptoms coming every day exactly at the same hour. That is the feature, and the three stages. The first one is characterized by thirst and no thirst in other two stages. In the chill stage, there is a red face, and in the hot stage, when we expect the patient to have a red face, he is having a pale face. Then chamomilla, it is also due to anger, especially chill and the fever. From anger, there will
Mhm.
be intermittent fever, nausea, bilious vomiting. So jaundice related or liver related, colicky pain, and painful emission of urine. Because yesterday we saw this is a medicine that can be given for UTI, etc. So any complaints where there is kidney involvement, nephritis, pyelonephritis, or there is a liver involvement with intermittent fever, we can think about. But the causation should always be something like anger, and they should also have that characteristic mental features. Fever that is characterized by chill, heat, thirst, fainting, and nocturnal aggravation. In the chill stage, the patient will be feeling that chilliness and coldness with burning hot face, hot breath, and violent thirst. Sweat stage, uh, usually comes up when the person is sleeping. And during sleep, the patient can start from the sleep with furious delirium, etc. etc. It doesn't matter that much. Then their nature should be this one. The pain seems unendurable. That drive them to despair. Everything aggravation by heat, evening. Then the cheek nature, one cheek red and hot, the other pale and cold. Pain with numbness also. Oversensitiveness to open air, though they like to be in open air because the especially about the ears, they are oversensitive. And in case of pulsatilla, fever due to gastric derangements, no symptoms are alike. They are ever changing. No two chills, two stools, or two attacks to be same. Very well 1 hour, very miserable the next. For them also, fever will be accompanied with pain, chilliness, and shivering. But what makes in this case is different is what I told you already. They want still to be in cold weather or
Uh-huh.
that cold air that gives amelioration. And chilliness is present in case of Nux vomica also, but in case of Nux vomica, they want to be in warm room. Then the characteristic pain, if it is present, that will be one nature of pulsatilla. We have already told that. Then thirstlessness, that is, be whatever be the stage of the fever, there is no thirst. Fever is associated with nasal congestion in case, then it will be thick yellow or blunt discharges. Then in case of lycopodium, there will be chilliness, especially during their time of aggravation, 4 to 8 p.m. And great coldness as if lying on ice. Thirsty with frequent drinking of small quantities at a time. I don't think that is important. This is important. But if you forget this one, it doesn't matter. Perspiration will be smelling sour. That's an important feature. Or smelling like onion or even bloody smell. The typhus fever with threatening paralysis of the brain or malignant fevers. Sensation as if circulation stood still. So that will be the feature of lycopodium. So not very simple features. All these pulsatilla we can think about in a casual viral fever also.
Mm-hmm.
Even Nux vomica, but Ignatia, Lycopodium, everything will be coming when it is typically intermittent fever, showing that something that is not a acute type but a subacute type of fevers like typhoid, typhus, when the main organs are involved, like that fever,
Okay.
Lycopodium and Ignatia. Um, then, then this is something I copied from one of the book or website. I don't know. We made a simple comparison
Uh-huh.
between Nuxmom and Ignatia. We'll just go through. I think we have almost done, but we'll just go through. Both remedies have strong connection to emotional stress and it affecting the body. Both will exhibit irritability, mood swings, and sensitivity. But Nux is associated with effects of a sedentary lifestyle, stress and overintelligence, but Ignatia due to suppressed emotions and grief. So here comes their difference, though uh, based on their causations.
Okay.
Chamomilla and Mazzatilla both are known for extreme sensitivity and irritability, restlessness, mood swings, and difficulty in managing emotions. However, in case of chamomilla, there is extreme irritability and that increased sensitivity to pain, while pulsatilla is characterized by changeable moods and a desire for sympathy. So here I would like to add that one sentence from what we say. Chamomilla, I mean, I'm not adding over here, but I will say that one. The mental tantrums, everything that will be indicating towards chamomilla and pulsatilla, they will be mentally calm people.
Okay.
Lycopodium and Nux vomica, both are good for digestive complaints, indigestion and bloating. They share a connection of issues of self-confidence and fear of failure. But Lycopodium is often associated with lack of self-esteem and dominance, while Nux vomica, they will be characterized by ambition, perfectionism, and a goal-driven nature. So these are the main comparison between these five drugs. I'll stop over here, 11:27. Uh, Now I'll go to one more drug, causticum.
Okay.
Causticum actually we have done last semester. Do you remember?
Mm-hmm.
Very good. Stop after causticum. Yeah, no, I don't want to take. I was planning to take hepaself also, but I felt hepaself. You are not taught hepaself, right? Or have you
Yes.
studied hepat?
Mm, not that I can remember.
Maybe not. So then I thought, okay, I'll just do with causticum.
Okay.
So, castricum, the common name is, if you remember my acronym task, or Tinctura acrosinicale. Chemical name is potassium hydrate, and it is obtained by distilling silicate lime or calcium hydroxide and potassium
Interesting.
sulfate. Is it calcium hydroxide itself?
I think so.
Okay, because I forgot chemistry. How long you have I studied chemistry in 1998, 2000. I mean, the plus two in the school also, but after this much years, when I said calcium hydroxide and you told something, I could hear some voice. I was like, oh, did I make a mistake? Because you just now did chemistry, but I did years back.
No,
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 I
no.
never.
It's correct. Calcium hydroxide. Yeah.
I was just doubtful. Okay, so the prover is Hahnemann itself, and he had called this as one of his greatest polycrust, keeping it along with sulfur, sorinum, etc.
Mhm.
And he had explained this in his book Chronic Diseases.
Okay.
And constitution people are more or less similar like that of sulfur constitution,
Mm-hmm.
where the persons are having a rich muscular fiber, dark hair, dark complexion, or they can be having an excessively yellow, dirty white complexion with warts, especially on the face. So they will be having some not so good looking face, or it will be because of their discoloration or because of their wart formation, or it can be also that there can be some eruptions and from which there will be fluid that is oozing out and
Mm-hmm.
crust formation. Anyway, the face won't be that attractive looking. So they will be having a dirty, unhealthy skin with respiratory and urinary tract infections also. But not just that, because it is a deep acting remedy, a constitutional remedy. It is having action on different systems of the body. In case of children, we have some more symptoms in them. They also will be having dark hair and dark eyes. Skin will also be dirty white, delicate, sensitive skin, or not so healthy people. Even their look will not be that healthy. They will be weak, emaciated generally, especially in the face region, but abdomen will be large. So more or less the people or the children who are having protein energy malnutrition, marasmus kwashiorkor, but the general body will be emaciated, but there will be protrusion of the abdomen.
Okay.
Scrofulous affections can be where there is glandular indurations, wherever there is the lymph glands. Also, the children may be having affections of eyes, ears, and scalp. When we go towards the skin, we will see that they can have the symptoms, especially the itching, intertrigo, and eruptions in the ears, scalp region, etc. Then there are chili patients and with right-sided complaints. So right-sided, another remedy would be lycopodium. And lycopodium is also a deep-acting remedy. They are suited mostly for chronic complaints which are gradually developing. Causticum, as we told, that is deep acting remedy and it will take some time. Similar is lycopodium also. Lycopodium also, its action takes a longer time to develop and
Mm-hmm.
it is also deep acting. So this is more suited for gradually appearing. It's not that today happened and tomorrow the complaints are happening. We
Mm-hmm.
can see such a causation also when we go towards the ailments from the sixth one. You can see there is sudden emotions, but usually even if there is sudden emotion, we usually don't give causticum for an acute complaint. Mostly it should be something that is constitutionally present and it is a deep or chronic in nature,
Okay.
gradually appearing. So they are well suited for rheumatic, arthritic, and paralytic affections. It is trimiasmatic in the background, that is psoric, psychotic, and syphilitic. Then causticum, the ailments from is mainly from burns or scalds. So this is a very good remedy which can be given for burning.
Okay.
even second and third grade. But how much effective will be, I really don't know, because when it is burning that is coming, I mean the burns or the scars, we tend to give cantharis actually. We
Mm,
usually give is cantharis, and maybe epis also. But causticum, they also have these burns or scars and can be given in second or third degree.
okay.
There can be fright due to some emotions like fright, long continued grief and sorrow, like what we saw in Natramure
Mm-hmm.
Ignatia. They have complaints from loss of sleep. Loss of sleep. Another important remedy will be, which you are not studied, coculus. Uh, then from suppressed eruptions, ulcers that is maltreated with lead. So towards later, we'll see that they are good for paralysis, especially the lead paralysis. So in case of ulcers, if they were maltreated with lead, this was a ailment from that we are mentioning from the past. So in the past, for the skin complaints, they used to suppress it with mercury ointments, ledum, and then ledum is the lead, and also mostly mercury. I told you ledum, zingamate, zinc oxide. So most of the skin complaints of that time, of Hahnemann time, it was suppressed using these chemicals. So the ulcers at that time, if it is maltreated with lead or a chronic lead poisoning, which led to the lead paralysis, then also we can think about caustica. For sudden emotions, that is fear, fright, joy, causticum can be given, but the best remedy would be coffee or another remedy. And anger and vexation. So when we see a lot of causations are related to the emotions, either fright, long continued grief or sorrow, and sudden emotions. Also anger and vexation. Then another different one will be burns or scalds, and then the suppressed eruption or maltreated with lead. Then, in mind, these are the people who cannot stand injustice. So, it is the leading symptom. Their intellectual personality with a strong sense of social justice. They do have the ability to judge what is right and wrong. They do idealistic fight for a better world. So, the people who we can say as revolutionists or young leaders,
Mm-hmm.
but they are a type of causticum. They can't stand injustice.
Okay.
However, in the second phase, when they do a lot of fighting for this social justice, and sometimes the world is so brutal, when they feel like whatever they do, the world is not going to get improved or something, they get into a stage of hopelessness, or which is the second phase. At this stage, the person is ruined from inside. All his nature that wish for social justice, everything that will be affected. He's ruined from outside inside, and he sees only the negative side of the world. He become ambitionless and develop a stage of mental fatigue. Like he did a lot, and towards the later, it will be like maybe in his teenage 20s, he tried a lot to bring about some changes. But after a lot of fighting, maybe in 30s or 40s, he feels to like give up. This world is never going to get better or something. So that hopelessness it comes in him, that whining mood, suspicious and mistrustfulness to anything and everyone.
Okay.
So he will go then, because of this hopelessness, he will go towards a melancholic mood where he is always sad and weeping. And this is about the adult I'm saying, but in case of a child, it is not that the child has gone through all these stages.
Uh-huh.
But in child, we can see a melancholic nature, like the least things make the child cry.
Mm.
The child doesn't want to go to bed alone, see fearful images when closing eyes, which is aggravated during twilight.
Okay.
Did I pronounce it correct?
Yeah, yeah.
I always have this confusion. Twilight. So don't confuse though. I kept the melancholy mood of the adult and this one, and we were coming in a sequence. Don't confuse that melancholy with the child. Okay, the child
Okay.
is not going through that social justice or hopelessness. It's just
Yeah.
that maybe the child is feared to go alone, and he needs always that company,
Yeah.
and he is so fearful that makes him cry. Because there is intense sympathy also. This sympathy we can see in children. intense sympathy for suffering. Like children, in the sense, even in their class, even small children, when they are going to school, they see some of their fellow mates, they're coming with no proper food or no proper packed lunch or something. They understand that his classmate belong to a poor family. That child can have this sympathy feeling. All the social justice and all, even if he doesn't know that much, a small boy can also feel this sympathy. So maybe that the child, the least thing makes that child cry, the least thing. Um, Memory failure can be because there is a mental paralysis. Uh, we saw that there is a paralytic affection in case of causticum, and that can be mentally and also physically. So, if mentally that is being affected, because it can affect this medicine, later we'll see it can affect the activities of brain and spinal cord. So, if there is a memory failure, there will be profound weakness and of memory. They will be making mistake, confuses with letters and also syllables. Sorry, this should be syllable. The spelling
Okay.
correct?
Syllables? Yeah.
Uh, so they will be confounding or confusing with the letters and syllables. With passing of time, they may get into a state of confusion. So the confusion, how it manifests at, they repeat the question first and then give answers. So when we are asking them some questions, they will first repeat that question and then give us the answers, like a
Mm.
confusion and constant fear that he had forgotten something. Then there is intense sympathy for suffering of others. But what I told you, respective of age, they can feel that. Then they can be also timid, nervous, anxious of some impending misfortune, conscience stricken, as if he had committed some crime. So over this, only this sentence maybe. So that's the mental feature. Don't forget this intense sympathy and also that they cannot stand injustice. That's most important, and melancholy also. Then, in case of the general features, they have got paralysis. It can affect both voluntary and involuntary muscles. The nature it will be gradually appearing and exposure due to cold wind after typhoid, typhus, diphtheria, etc.
Okay.
Another feature of this paralysis is it affects the single, whatever it is single. That means single nerves may be affected, or single muscles, or single parts. And as like yesterday, now we are saying about the paralysis of single parts. And if it is twitching or jerking, what were the medicines yesterday we told?
Um, agaricus and zinc. Yeah.
One more.
One more. Like, is that an I?
Hmm?
Wait, no. Ignitia.
Hmm. If it is now the paralysis is single parts, it's caustica, but pitching or jerking of single parts, it's agaricus, zingamet, and ignatia. And this one actually, though we say paralysis, it is possible in case of causticum to
Mm-hmm.
have pitchings and jerkings also, not just paralysis.
Oh.
Paralysis is the most important feature and of single parts, but there may be jerkings also.
So how
Uh,
about it?
I mean, mostly it will be paralysis. Mostly it will be paralysis. But you know, when we say the textbook, because it is the patients who told the symptoms, not patient, the provers, we get symptoms that are confusing.
Okay.
Uh, they will be saying like over here also when we say that it is the paralysis that is affected, then we see the next sentence saying that there will be twitchings and jerkings also. So what we need to understand is, are we getting that causticum personality over there?
Okay.
And 80% of the time we are expecting that person to have some paralytic complaint, or the person is coming to you with a paralytic complaint and you are matching whether this person is having the causticum feature. So if you get that causticum personality over there, all the whatever guiding symptoms we are seeing, then if he is having paralysis, well and good. Even if he is not having paralysis but it is convulsions or twitchings, that shouldn't stop you. Once you got that constitution, and if it is a chronic complaint where you have to give the constitutional remedy, we need to go to the constitution and the guiding symptoms, whether it is matching. So we don't have to bother for the particular symptoms. That is why everywhere when we do the evaluation, particular symptoms are given very less value, like 1 point or something. It's just that when in case you are practicing, a patient come to you and his complaint is epilepsy, and when you take the case, you feel like the patient can be given caustic. So then at that time, there shouldn't be anything which stops you from prescribing causticum, thinking that, oh, in causticum, you have never learned there is epilepsy or twitchings because you always learned paralysis over
Paralysis.
there. Yeah. So why now it is twitching? Why shouldn't you give? So in non remedy, in homeopathy, we say like that. Even if there is no symptom, we have learned or somewhere in materia medica, but a patient comes and you're sure that the totality is matching to one drug, then better give. It may be that this symptom has been given in the materia medica source book when
Okay.
Hahnemann proved it. We are never reading that. So maybe that was at least maybe one or two patients have proved that symptom. Maybe only it didn't come to our main textbooks. In Boric or Keynote, what we study is actually the symptoms given by many of the people, proved, reproved. There is a criteria that is followed. So only those symptoms are included, and we study only that book or boric or whatever. But if we go for the source book, the heading guiding symptoms or this Materia Medica Cura of Hahnemann, uh, there may be like one or two patients who have, not patients, sorry, the provers who have given that particular symptom of twitching, which we didn't know. But that doesn't mean like we shouldn't give. So maybe if the constitution matches and if we are giving, it will be acting if the constitution is matching. So nothing should stop you, but this is something that you have to remember when you are practicing. But when
Mhm.
you are writing the exam, I would say you to remember the paralysis. Because in writing, we write something not exactly different, but when we practice, we need to think something, everything else also. So at that time, you shouldn't think like, okay, teaching was not mentioned, so how can you give causticum? Nothing like that. But during the exam, you write about twitching, but you don't mention paralysis.
Uh-huh.
That will be a problem.
Oh.
Understand just the difference. One study is for exam and another study is for the practice. Actually, both should go hand in hand. But then it will be difficult for us to remember all the symptoms. For exams, we have to study such a lot of drugs, and to remember all the simple and not so important symptoms is also very difficult. In
Okay.
case when you are practicing, you are getting time. If it is a constitutional remedy, you can just prescribe the patient SL when you are not sure. And then if it is a constitutional, I mean a chronic complaint, okay, not the acute. Acute, you have to do something. But if it is chronic, you can give a placebo and say the patient you come 2 days later or 3 days later. Where you can also ask him to do some blood test or something, and then he comes with the report. Or it can be also that you, in that meanwhile, you can do a repetrization, you can do a study of material, you can find the constitutional remedy, the proper constitutional remedy. You get time for a detailed study. But this time you won't get in during exam. So that's
Okay.
why in exam you have to study the most important. So don't get confused. Mostly it is the paralysis itself, but twitchings are also possible. So paralysis of single parts. There can be ptosis. You know what is ptosis, right?
Yeah.
Facial paralysis, paralysis of tongue, vocal cords, bladder, rectum, extremities, etc. and also complaints of leg paralysis. And leg paralysis, mostly it will be affecting the extensor muscles, which lead into wrist drop. This is a feature of leg paralysis. Then paralysis can be seen in children also, where they exhibit as slow learning to talk and walk. And when children they are attempting to walk, they will be walking unsteadily, or they have a tendency to frequent falling. Then they will be restless, especially at night, and legs are constantly on the go, like the singer mat. At night, unable to get an easy position or lie still for a moment. Hence, patient must move constantly, however, movement doesn't relieve. So, this restlessness is the uh, but the second sentence is more important actually. The patient is unable to get into an easy position or a comfortable position or lie still in a moment. He always has to move his legs,
Yeah.
and even though he moves constantly, the movement doesn't relieve. There is a constant restlessness. Then this rawness and sore sensation, it is very characteristic of causticum. Rawness is like a tenderness,
Okay.
as if the affected area is exposed, a sensation as if rubbing a raw wound, because this is indicated in burning, I told you, and also in this case, the cicatrices can break open, as I
Okay.
kept in the particular setting. The cicatrices or the uh, scar wounds can break open.
Mm-hmm.
So they will be having that raw sensation or soreness, that muscle ache, etc. They will be having that. And it can be present in any part, in the scalp, in the throat, respiratory tract, rectum, anal, urethra, vagina, uterus. Any organ that can be affected can be seen in piles, cuff, etc. After effects of burns and scalds, the patient says, I have been never well since that burn. In Ignatia, we were saying that she has been never well since that puberty age or the
Uh-huh.
menstruation. Here, he will be saying that he has
Right.
been never well since that burn. Burning is an important feature of causticum because there is caustic potash also, and that's burning. Caustica can be used in the treatment of second and third degree burns. There will be burning and itching on face, discharging an acrid fluid which forms crust on face. That's why I told you even the skin, the face will be disagreeable or not that attractive because of this some crust present or the warts that is present over their skin. And because of this skin eruptions, everything, the skin will not be feeling healthy, or it will be dirty white. Yep. And as Hahnemann told, it stands with other two of his main mathematic or the deep acting remedy or the anti-mathematic. That is a feature like sodium and sulfur. Patient improves for a time, then comes to a standstill. If you have learned in organon,
Uh-huh.
um, have you learned the aphorism where Sora is defined? The Hydra headed Sora, something, something, something. That's a whole paragraph
Uh-huh.
about Sora.
Uh-huh.
So, in that definition, I don't know
Okay.
which aphorism it is. It's somewhere from 70 to 80, somewhere it is mentioned. There is a term like hydra-headed Sora. That's the only word I'm remembering now.
Uh-huh.
But in that, there are a lot of features, Hahnemann says. And Hahnemann says that if it is the Sora that is lurking behind a disease, and if you are not giving that right anti-miasmatic remedy or the anti-psoriatic remedy, the patient will be improving for a time, and then everything will come to a standstill. You're sure
Oh,
that your medicine is indicating the remedy, the potency, something is not active, but you're sure about that, then it is there is a need to give an antipsoric remedy as an intercurrent.
okay.
So that feature we can see in sovereign sulfur and also in causticum. So this is a common feature actually of all the deep acting antipsoric remedy.
Okay.
Then there can be neuralgia or rheumatic affections. We saw that there will be tearing, drawing pain, stiffness similar to that of Rustox. There will be stiffness of joint, tension, shortening of muscles, contracted flexors, similar to the feature what we say in rheumatoid arthritis. So like Rustox, that stiffness of joints, drawing pain, shortening of muscles, etc. Then this is a right-sided complaint, right-sided remedy. Whatever be the complaint, paralysis, chorea, neuralgia, everything will be right-sided. Then in head, the most important symptom is ptosis. Vertigo can be there when the patient tends to fall forward or sideways. Not that important, but remember headache with ptosis.
Okay.
And in respiratory complaints, same we will be having that rawness and sore sensation, so that, and the symptoms will be important cough on expiration. And at that time, the concomitant with pain in hips, which is also characteristic. So person is coughing, and then there is a problem with the distant part, like there is pain in the hip region. So
Mm.
this question can be asked as a MCQ.
Okay.
Cough with pain in hips.
Okay.
Then this cough will be remaining after pertussis, which is usually seen at night, and then cough is ameliorated by drinking cold water. So we saw that the costricum patient is actually chilly patient,
Uh-huh.
but still they are having amelioration by drinking cold water, especially cough. And in cough, there will be mucus accumulation in larynx, fauces, throat, eustachian tubes, or wherever. But the most important feature is they cannot expectorate that mucus. That has to be swallowed because of that paralytic sensation. They won't be having even the strength to raise that expectoration and to throw it out or spit it out. They will be, for their ease and comfort, they will be just swallowing it because they don't have uh, even that capacity or the strength, and that shows the paralytic nature, that they are not able to raise that expectoration. Then there can be hoarseness or aphonia, especially due to paralysis of vocal cords, and that is aggravated in morning. In GIT, there is fullness and pressure in abdomen as if it would burst, which is aggravated from food. And this fullness can lead to pain, which is ameliorated by bending double. Actually, these two symptoms, because I had to go according to the sequence, that is why I kept. It is not that important,
Mhm.
though we can see some similarity of the drug causticum with lycopodium over here, because
Mhm.
lycopodium is also having similar symptoms. We have seen that in lycopodium also there is easy satiety, even a little bit of
Yeah.
food that is going to be mouthful. So definitely there is pyrosis. They want to loosen their stomach region. Even this we can see in Naxmom also. But then we have to go, the whole constitution of three drugs are different. So the most important symptoms will be in case of their constipation and hemorrhoids. So in constipation, it is due to rectal paralysis or impeded by hemorrhoids. The most important feature will be they pass stool while standing. So when standing is there due to the gravity or that particular posture, the hemorrhoids or won't be affecting or impeding the movement of the stool. So that particular posture is attempted when they are passing stool. So they pass stool while standing. That's the important feature of GIT. And in hemorrhoids, the hemorrhoids, okay, it is aggravated from walking and touch, etc. But the most important feature over here will be the stool, which is covered with shining coating of a mucus or like grease. Now,
Miss,
who is going to?
I have a question. When they say passes through while standing, does it mean they do it um like are they aware of it or does it happen without,
No, they
with
are aware of it.
oh,
They are not able to sit on the pan to pass the stool. For them, the comfortable position will be maybe when they are sitting, because they have that hemorrhoids.
okay.
They might be having some posture problem when they are sitting on the pan. So they might have felt they can pass the stool only when they are standing. That might be, these attitudes, especially the body attitudes, people assume different attitudes when they are having certain complaints. If we notice in ourselves, we may not be passing stool while standing, but if, when there is some other complaints, we may get into some attitudes which we never do before. So probably this attitude they used because of this hemorrhoids and the stool was not going properly or coming out properly,
Mm.
and they had to strain a lot. So these people, uh, everyone will be trying to cope up the problem they have in their own manner. So when we go to a drug like alumina, it is told that they will be pressing their toilet seat very much to pass the stool actually.
They will be
So in
pressing
this
their what? Sorry?
toilet seat,
Oh, okay.
very strongly. I mean, that
Uh,
much pressure they have to give to pass the stool. So for them, these people, they will be having that difficulty, and it's mainly due to hemorrhoids anyway. So they felt like if they are going to stand, the stool is passing more comfortably. That's why they took that position. So they are conscious about it. They pass stool while standing, conscious about it. And the patients, these symptoms, when patients come, they will be usually saying these symptoms. And there can be also another reason, but I don't think, because these symptoms, this proving was done in European countries, so definitely the toilet style is different, the European style. But I have heard this complaint from Indian people, what they say, and it is not due to hemorrhoids or something, it is actually due to their knee joint pain. Because of the Indian closet, the squatting one, they are not able to squat on it or sit in that squatting position is not possible for them because of their knee pain or whatever. Whatever in the sense, knee joint pain itself. So they go into a standing position and then they pass to. So this is something like patients do according to what they feel to be a comfort. In
okay.
case of causticum, they have this passing stool while standing, and I think similar symptom in case of passing urine we have in case of uh, zincomet. Zincomet is having such a similar when they are, yeah. In case of Zingamet, they can void urine only while sitting and bending backward, not
Okay.
standing, but sitting and bending backward. So maybe that gives them less pressure. There might be some reason, but it is anyway related to the anatomical things like
Okay.
the pressure symptoms. So to overcome that pressure symptom, the patient comes out with such a comfortable attitude. That will be the reason.
Okay.
Then in hemorrhoids, the stool will be covered with shiny coating of mucus, or the mucus layer will be the, which also shows the hemorrhoid nature, and it will be greasy. And this hemorrhoid complaint we can see in children with nocturnal enuresis. So already we had explained about the causticum child, their constitution, and their mental feature, the intense sympathy, the terror. So everything is coming. And then we have this complaint of hemorrhoids. We can think about causticum. And then I was going actually how it is possible in children hemorrhoids to be. But then I saw that in children there is one worm, the one parasite that is Trichura trichuris.
Okay.
Uh, it can lead to hemorrhoids actually.
Oh.
One of the after effect of Trichura trichuris is hemorrhoids actually. So whenever there is a worm infestation, the children will be having that itching sensation and they will be having this nocturnal enuresis. So in our Materia Medica book, they have given only in children with nocturnal enuresis. So it is very difficult for us to connect how this nocturnal enuresis can result in hemorrhoids. But the actual connection is coming from the, so nocturnal enuresis is seen in children who have got parasitic infestations. And one of the parasite that is Trichura trichuris, its complication is hemorrhoid. So likewise the connection comes. Then it is urinary organs, FRS. Shall I continue or shall I stop? Only this much
Mm,
is the.
let me just let you can still continue.
Okay. Let's just go easily. I mean, quickly. You know that. So urinary organ, urinary bladder. There is paralysis. So there is incontinence. urine is not going to be under his control. It is going to go whenever something is going to happen. Like he lost his control in urine or
Okay.
bladder control. So that is the symptom. There will be urinary incontinence, the loss of bladder control, especially due to paralysis of muscles or sphincters in shop girls, school girls who do not have the opportunity to attend urination at needed times. So after some time, they lose their control. The urine can escape involuntary while coughing, sneezing, blowing the nose, laughing, walking, etc. And in children, if epilepsy if, that is occurring at night, urine can escape. Then enuresis is especially seen during first sleep. This is important actually. Enuresis during some of the medicine you will be learning sepia, creosote, etc. At
Uh-huh.
that time, enuresis at which stage is important, whether it is in the initial hours of his sleep or in the later hours, that's important. So in case of causticum, it is during the first sleep. Aggravation
Okay.
in winter and amelioration summer, we can connect it to the general chilly nature. In
Okay.
case of menses, it will be too early, too feeble, flow only during daytime, ceases on lying down. So this is a feature in case of female reproductive system, that the flow of menses is only during daytime. And
Okay.
when we go to zingomet, it is only flow during night.
Like, yeah.
And earlier, when we were saying about pulsatilla, we saw that pulsatilla flow is more during day. We
Yeah.
can't say it is exclusively during daytime, that we can't say.
Uh-huh.
But it is more in case of pulsatilla, the flow is more during daytime.
Okay.
Uh, so remember this, the flow only during daytime, that is constant. There will be a lot of remedies coming later where that needs,
During
I mean,
daytime.
the timing changes.
Ah, okay.
Then, in case of skin, the cicatrices I told you, they are good for burning, scalds, etc. So that can produce cicatrice.
Huh?
So this can freshen up or it can reopen and it becomes sore again. So that might be the reason for that rawness and sore sensation also in them. Then there will be warts, and warts it can be large one with peduncles easily bleeding or exuding moisture, or it can be several small ones which is present all over the body, especially face, nose, eyelids, fingertips, close to nails, etc. That's why in the face, either the warts will be present, small warts on warts that is present all over, or it can be the acrid discharge coming out from the eruptions on the face, which
Mm-hmm.
lead to that crusty nature. Then I told you the eruptions in children, they have eruptions especially in the scalp and ears. So this is an important feature, the eruption that is seen on scalp behind ears. Here, when you learn graphitis also, usually the skin complaint of graphitis and causticum can be asked for a comparison.
Huh?
So this is the only similar feature between them, that both the medicines can be given for the uh,
Eruptions behind
yeah,
ears.
behind ears, in the scalp. It is seen on scalp behind ears. So this particular position.
Okay.
So how then we compare and contrast? So the other features will come, and there is many similarity between causticum and graphitis. In graphitis also we have a delayed menstruation. Graphitis is also chilly patient. Graphitis is also similar to pulsatilla. They are a bit stout persons. Um, Chili patient. Do have some GIT complaints. Constipation and hemorrhoids is also them. So there are some many symptoms similar to caustica. But when we come to that Mendel features, caustica Mendel feature is completely different. And causticum we have seen it will be dark constitution, that dirty white skin and all. But graphitis, they are like pulsatilla, very fair, beautiful, stout persons, slightly anemic. And the Mendel feature is also very different from that of causticum. So though many symptoms are similar, many other constitutional symptoms are different in them. So for that, usually the skin, because the similarity, only this sentence is coming, graphitis and that one, caustica can be asked for a skin. And in graphitis, they don't have this warts complaint, but they have something like what is that, fissures or the skin being getting into ulcer, unhealthy. So many features are there. Then sticky fluid will be coming out in causticum. It's not that characteristic sticky offensive fluid that is coming out. Anyway, so these are some differences between them. Then the skin is prone to intertrigo during dentition that we saw in lycopodium and yesterday in chamomilla also. And in extremities, we saw that in guiding symptoms, the rheumatic affection, where there is contraction of the flexor muscles, there is stiffness, tension, and shortening of muscles. What we saw in rheumatoid arthritis itself. So there will be a sensation of tightness or limited flexibility, often associated with reduced range of motion. And extremities, when we say extremities, that contraction, everything, we can connect. I mean, this can be added into nervous system also, because the contraction can be due to, 1 minute, let me make this correct. Uh, this contraction, it can be purely due to muscle contraction, but it can be also due to nerve innervation problem. That the muscle contraction or the movement is not proper because of the innervation also.
Okay.
So we can put this symptom both. When we are keeping the symptoms, we have to be very careful. Like when brustox comes, brustox extremities means we will be concentrating only in the rheumatic complaints,
Yeah.
because we know in their origin and their pathogenesis, everything, it is only the muscles that is affected. The neuralgic involvement is very, very, very less. It should be that chronic myalgia that is present. But because causticum is having a neuralgic action also, a paralytic effect also, whenever we say extremities, we can't just concentrate with the rheumatoid arthritic features alone. We can intermix. What I told is extremities feature can come over here also, nervous
Okay.
system. Though I separated it out, when you are writing for the exam, you can keep it over here also. So nervous system, the thing will be, it is not convulsions or something. It is actually the paralysis. Actually, there was this thing, I think, twitching and all, which I changed because from your level, BHMS level, it's okay. You don't have to remember for the exam purpose.
Okay.
So paralysis that we discussed earlier, it will be single parts affected, the right-sided, exposure from cold, wind, draft, typhoid, typhus, etc. And paralysis, it is due to the disturbed activity of brain and spinal cord, especially after an effect of exhausting disease or severe mental shock. So some mental shock or exhausting disease that affected the CNS, the brain and spinal cord, and that leading to paralysis. And this paralysis will be usually single part or and right-sided. And this paralysis, we saw that it can affect the brain also, which is manifested as forgetfulness. Then they may also show stammering on account of excitement or anger. This is in case of adults, but in children also we have seen that the children will be slow to talk and walk. About it, we told that. Do you remember?
Mm-hmm.
Where is that? The child will be, they cannot walk properly. Somewhere we have that. The child slow learning to talk and walk. So walk we connected to that paralytic nature, but even for talking, that stammering we can connect. So stammering, it's usually from that anger, vexation, or whatever we see in adults, but even in children, if there is stammering, you can think about that.
Okay.
Then fever, because they show periodicity, this can be indicated in intermittent fevers. And the characteristic feature of their fever is after to chill, there is no heat stage. It is directly sweat stage. That's the characteristic feature. And they can't cover too warmly because warmth does not ameliorate. Even though they are chilly patient, the warmth does not ameliorate or they can't cover completely. And there is no hot stage. Still, they can't bear that warmth. Then aggravations, a clear fine weather is aggravation for them. Remember that. It's only few remedies which has that symptom. So clear fine weather, when everyone feels so ameliorated, everything happy, they are having aggravation. Then coffee, 3 to 4 a.m. aggravation is also seen. And amelioration in damp, wet weather. They crave for smoked things and smoked meat, which we also can see in calcarea force. Another drug. Um, so this is a picture that I copied. You can see the causticum, potassium sulfate, and calcium hydroxide.
Mm-hmm.
And we have the mental symptoms, the melancholy, hopelessness, intolerant to authority, the chronic fatigue nature, the fear, especially in children, imbecility. Not sure. Fanaticism is usually whenever they feel like they are intolerant. I mean, the intolerance in the sense they are not able to, they're fighting for the justice, and when they are not reaching the second stage was hopelessness. But
Yeah.
in between, when they completely go to the hopelessness, before to that, they can go through a fanatic stage also, where they just wish for an ideal world uh, where every people are equal actually. So that fanaticism is what they mean over here. Then physical symptoms, the gradual paralysis for muscles and tendons, their contraction, jerking, cramps, etc. Paralytic pain, facial eruptions, warts, powerful cough, but still they can't expectorate, it has to be swallowed. Loss of urine or that urine control has been lost. Then desire for salt and smoked wheat, which we see in calcarea carb also. And aversion, what is this aversion?
Sweet. Looks like
Sweet?
I don't know.
Ah, okay.
Looks like M&M. It
Eh?
looks like M&M.
M&M means?
You know M&M, M&M, the
It's
sweets.
like a gems. I
It looks
think.
like it's
I mean, that's colored, and inside that there is some chocolate. Is it?
yeah.
Ah, yeah, we get that in India also. We call it as gems. GEMS.
Oh,
You call it
okay.
as Amanda?
M&M's. Yeah, it's a brand. It's a chocolate brand.
Even Gems is actually a chocolate brand.
Oh, okay.
Maybe it's the same company. If you go now, the same Nestle would be producing it. They name it different in different countries.
Maybe.
And
Could be.
when I thought is it Gems, but then I was like, is it Gems? It's okay. Then yeah, this is regarding their thermals. So amelioration from cold water. We saw that.
Uh-huh.
Then aggravation from cold, dry wind. Okay. Epilepsy in young children or young person, first degree burns, multiple sclerosis, where we can see this paralysis and
Okay.
neurosigility. Okay, so that's about causticum. Hepacell we'll see in next class. So next
Okay.
class, Wednesday, first hour we'll have the exam, and after to that we'll do Hepacell.
Okay.
Okay, then. Thank
Wait,
you.
so our midsem will cover until just yesterday's topic, right? Not until Kostika.
No, causticum is coming from the different section, right? It is coming under calcarea carb, calcarea force,
Oh,
everything. Yeah. So no, no, no. Only until yesterday's portion,
okay.
not this.
All right.
Okay.
Thank
Did
you,
you
Miss.
take the
See,
screenshot?
see you next week. Yeah, I've taken the screenshot. Yeah, I'll
Oh,
send you. All right.
okay then. Bye.
Thank you
Thank
so
you.
much. Bye bye.